Hello and welcome back to the Herbal Podcast, where we discuss all things herbs and horses to help you and your horse live a happy, healthier life naturally. I am Kayla Dendy, your master herbalist, and today we will be delving into the world of ashwagandha. This is an ancient herb with a remarkably rich history, one that is deeply rooted in the traditional Ayurvedic medicine of India. Its documented use can be traced back over 3 millennia, solidifying its status as one of the most important and revered herbs within the entire Ayurvedic pharmacopoeia. It stands as a testament to the enduring wisdom of ancient healing practices, continuing to be relevant in our modern world. The influence of ashwagandha is not confined solely to Ayurveda. Its therapeutic value has been recognized and integrated into various other traditional medicine systems across the globe. For instance, it holds a significant place in Unani medicine, a Perso-Arabic system of traditional healing. Furthermore, its benefits have been harnessed in traditional African medicine and by numerous indigenous cultures, each adapting its use to their unique health philosophies and local needs. This widespread adoption across different continents and cultures underscores the herb's versatile and powerful properties, demonstrating a universal appeal that transcends geographical and cultural boundaries, making it a truly global herb with a long and storied past. As we explore ashwagandha today, it is essential to approach this topic with both curiosity and caution. As always, please make sure to speak with your doctor or your veterinarian before utilizing any herbs or engaging in alternative medicine practices for yourself or your animals. This podcast is created for informational and educational purposes only. It is not intended or designed to be a substitute for qualified professional medical advice, diagnosis, or treatment. Our goal is to empower you with knowledge, so you can have more informed conversations with your trusted healthcare providers about the well-being of you and your horse. The journey into understanding ashwagandha begins with its name, which itself tells a fascinating story about its perceived effects and characteristics. The name ashwagandha is derived directly from the classical Sanskrit language, a combination of 2 distinct words. The first word, ashwa, translates to horse, an animal universally symbolic of power, stamina, and vitality. The second word, gandha, means smell or aroma. Together, they refer to the herb's distinct and earthy aroma, which has often been likened to the scent of a horse. This unique name is not merely descriptive but also deeply symbolic of the herb's traditional use. Beyond the literal translation of its name referring to its unique smell, there is a deeper, more symbolic interpretation that has been passed down through generations. Many herbalists and Ayurvedic practitioners believe the name ashwagandha also alludes to the herb's profound ability to impart the strength, endurance, and vitality of a horse to those who consume it. This powerful imagery captures the essence of its role as a premier strengthening tonic, an herb believed to build resilience and vigor from within. It paints a picture of an herb that does not just heal, but also fortifies the body and spirit, helping one to meet life's challenges with unwavering stamina. The plant's botanical name, Withannia somnifera, provides another layer of understanding regarding its historical and therapeutic applications. The species name, somnifera, is a Latin term that translates to sleep-inducing. This name directly points to one of its most celebrated traditional uses as a calming and restorative herb. It was often employed to soothe the nervous system, quiet a restless mind, and promote deep, restful sleep, which is foundational to the body's healing and rejuvenation processes. This calming aspect complements its strengthening properties, highlighting a holistic approach to wellness that balances energy with restorative peace, a key principle in Ayurvedic medicine. Ashwagandha's esteemed status is well documented in some of the most ancient and foundational texts of Ayurveda. It is prominently mentioned in scriptures such as the Charaka Samhita and the Susruta Samhita, which are considered the cornerstones of Ayurvedic medical literature. Within these revered texts, ashwagandha is classified as a Rasayana, a special category of herbs known for their rejuvenating and life-extending properties. Rasayanas are intended to promote longevity, enhance vitality, and restore the body's youthful state. Being placed in this elite class of herbs signifies its immense importance and its central role in promoting overall health and preventing disease in ancient India. The belief in its power was so strong that it was thought to impart the very vigor and strength of a stallion to individuals who consumed it on a regular basis. Its historical significance is further cemented by its mention in the Vedas, the most ancient and sacred Hindu scriptures, which date back even further than the medical Samhitas. Ashwagandha, scientifically known as Withannia somnifera, is a small, evergreen, woody shrub that presents a rather humble appearance in the plant kingdom. It is a member of the Solanaceae family, also known as the nightshade family, which includes familiar plants like tomatoes and potatoes. Typically, this resilient shrub can grow to a height of over 3 feet, or about 1 meter, developing a sturdy branching structure. The plant is covered in a dense mat of fine, woolly hairs, giving it a slightly silvery or grayish-green appearance. Its leaves are simple, oval-shaped, and arranged alternately along the stems. They are dull green in color and can grow up to 4 or 5 inches long, contributing to the plant's overall modest and unassuming look. Despite its powerful medicinal reputation, the ashwagandha plant itself is fairly plain and nondescript for much of its life cycle. It produces small, inconspicuous, bell-shaped flowers that are greenish or pale yellow in color. These flowers eventually give way to the plant's most visually striking feature, its fruit. The fruit is a small, bright orange-red berry, about the size of a pea, which is enclosed within a papery, lantern-like calyx, similar to that of a tomatillo or ground cherry. This vibrant berry provides a stark contrast to the otherwise muted tones of the foliage and stems, serving as a key identifying characteristic of the plant once it reaches maturity and begins its reproductive phase. This hardy plant is indigenous to the dry, subtropical regions of India, as well as other parts of Asia and Africa, where it has been a cornerstone of traditional medicine for centuries. It thrives in open, sun-drenched areas and is remarkably adaptable, growing in a great variety of soils. However, ashwagandha shows a distinct preference for dry, stony, and even sandy ground. It is often found growing wild in wastelands, disturbed environments, and along roadsides, demonstrating its incredible resilience and ability to flourish where other plants might struggle. This adaptability has allowed it to colonize a wide range of habitats, from arid plains to scrublands, as long as it receives full exposure to the sun. Because ashwagandha has such an extensive natural range, spanning multiple continents and diverse climates, considerable variations have been observed among local populations. These differences are not just morphological, meaning they affect the plant's physical appearance, such as its size, leaf shape, and hairiness, but they are also chemotypical. This means that the chemical composition and concentration of active compounds, like the withanolides, can vary significantly from one region to another. These variations are influenced by factors like soil type, altitude, rainfall, and temperature, leading to a wide spectrum of local species and ecotypes, each with its own unique profile of medicinal properties and characteristics. The current naturalized distribution of ashwagandha is incredibly broad, reflecting its successful adaptation to various environmental conditions across the globe. Some botanical sources describe its range as extending from Spain and the Mediterranean region eastward across the Middle East and into north-central China. Other accounts detail its presence throughout almost all of Africa, from the northern coast down to the south. This vast geographic spread also includes its native lands in South-Central Asia, particularly the Indian subcontinent. The plant's ability to naturalize in so many different areas highlights its robust nature and has contributed to its integration into numerous local herbal traditions far beyond its original home in India. The main parts of the ashwagandha plant that are harvested and utilized for their medicinal properties are the roots, the leaves, and sometimes the entire plant. While the leaves do contain beneficial compounds and are used in some traditional preparations, it is the root that is most highly prized and extensively used in both traditional Ayurveda and modern herbalism. The roots are typically harvested in the autumn after the plant has matured and its berries have ripened. They are then carefully washed, chopped, and dried in the shade to preserve their potent chemical constituents. The distinct aroma of the fresh root is what gives the plant its name, ashwagandha, meaning smell of a horse. The physical characteristics of the root are quite specific. It is a long, tuberous root that is fleshy and whitish-brown on the outside. When dried, the root becomes firm and woody, developing a more brownish color. It is known for being starchy and containing a complex array of alkaloids and steroidal lactones, which are collectively known as withanolides. These compounds are believed to be responsible for many of the herb's therapeutic effects. The quality and potency of the root can be influenced by the age of the plant at harvest, the growing conditions, and the post-harvest processing methods, all of which are critical factors for ensuring a high-grade final product for medicinal use. In summary, ashwagandha is a small, unassuming shrub distinguished primarily by its bright red fruit. It favors dry, stony, sun-exposed environments and is found in wastelands and disturbed areas across a vast geographical range from Africa and the Mediterranean to China. This wide distribution has led to significant morphological and chemical variations among different local species. The most medicinally valued part of the plant is its root, though the leaves and the whole plant are also used. This humble plant's resilience and adaptability have allowed it to become a globally recognized herb, deeply embedded in the medicinal practices of numerous cultures far and wide. The history of ashwagandha is a long and storied tapestry, woven deeply into the fabric of traditional healing systems for millennia. Its use in Ayurvedic medicine, the ancient system of health and wellness from India, extends back an astonishing 3,000 to 4,000 years, making it one of the most enduring remedies in human history. Within this tradition, it is not merely another herb, but is held in the highest regard, often considered a panacea capable of addressing a wide spectrum of ailments. This revered status is also mirrored in Unani medicine, a traditional system with roots in ancient Greece and Persia, as well as in various Middle Eastern healing practices, where it is celebrated as a powerful aphrodisiac, a general panacea, and a profound rejuvenative agent. In its long history, ashwagandha has been widely extolled as a superior tonic, particularly for conditions of emaciation and weakness. It was seen as a foundational remedy for rebuilding strength and vitality in people of all ages, from frail babies needing nourishment to elderly individuals seeking to maintain their vigor. One of its most celebrated applications was in enhancing the reproductive function of both men and women, where it was believed to promote fertility and sexual health. This broad application speaks to its role not just as a medicine for sickness, but as a fundamental pillar of maintaining robust health and ensuring the continuation of life and vitality through the generations. Beyond its use as a tonic for general weakness, ashwagandha was also historically employed for its potent anti-inflammatory properties. It was a primary remedy for painful conditions such as arthritis and rheumatism, helping to soothe inflamed joints and restore mobility to those afflicted. Another significant traditional application was in the treatment of respiratory conditions like asthma, where it was thought to calm the airways and ease breathing. Its role as a major tonic extended to counteracting the inevitable effects of aging, where it was used proactively to promote a state of youthful longevity, helping the body to remain strong, resilient, and full of life well into its later years. The versatility of this remarkable herb is further demonstrated by some of its more specific traditional uses. For instance, it was sometimes utilized as a mild purgative to gently support regular bowel movements in cases of chronic constipation, helping to maintain digestive health. Additionally, it was prescribed for the treatment of swollen glands, indicating an understanding of its effects on the lymphatic and immune systems. For musculoskeletal conditions, from simple aches to more complex disorders, it was a go-to remedy. It was also given as a general tonic to increase energy, improve overall health, and prevent disease in specific populations like athletes, the elderly, and even pregnant women to support their unique physiological demands. Within the sophisticated framework of Ayurveda, ashwagandha holds the esteemed classification of a Rasayana. This term refers to a special category of herbs that are used to maintain optimal physical and mental health, gently ease the burdensome effects of the aging process, and act as a deeply strengthening tonic. Rasayanas are not typically used to treat acute diseases, but are instead administered to rejuvenate the entire system, restore balance, and enhance the body's innate resilience. In this capacity, ashwagandha was often given daily as a preventative measure to support overall health and to facilitate healing, acting as a foundational element for a long and vibrant life. This Rasayana status meant that ashwagandha was administered across the entire lifespan, from childhood to old age. It was a trusted remedy for children experiencing failure to thrive or general debility, helping them to build strong bodies and robust constitutions. For adults, it was a source of enduring energy and vitality, particularly during periods of convalescence when recovering from a serious illness or surgery. In such cases of debility and persistent fatigue, ashwagandha was considered unparalleled in its ability to restore strength and bring the body back to a state of equilibrium. It was seen as a way to replenish the body's deepest energy reserves, which are often depleted by sickness and stress. The concept of a Rasayana herb in Ayurveda shares many striking similarities with the modern Western herbal concept of an adaptogen. Much as adaptogens are understood today, Rasayanas like ashwagandha are considered particularly helpful for promoting restful and restorative sleep, reducing feelings of anxiety, and increasing both physical energy and cognitive function. They work by enhancing the body's non-specific resistance to a wide range of stressors, whether they be physical, emotional, or environmental. This holistic action supports the body's inherent ability to cope with the damaging effects of chronic stress and disease, thereby preserving its vitality and preventing the breakdown of its systems over time. Ayurvedic practitioners also held a strong belief that ashwagandha could significantly improve memory and cognitive function, making it a valuable tool for mental clarity and focus. They recognized its ability to boost the immune system, making the body less susceptible to infections and illnesses. Furthermore, it was used to promote a profound sense of relaxation, calming the nervous system, and easing the mind. This ability to help the body fight inflammation was also central to its use, addressing the root cause of many chronic conditions. These multifaceted benefits underscore why it was considered such a complete and holistic remedy for nurturing both the body and the mind. The root of the ashwagandha plant has long been prized for its rejuvenating effects, earning it the nickname Indian ginseng for its ability to restore vitality and combat stress. Traditionally, ashwagandha was prepared in various ways, mixed with milk and honey for children, or as a decoction for adults facing stress or insomnia. Its sleep-inducing qualities made it a go-to remedy for calming the mind and promoting deep rest. Externally, ashwagandha paste was applied to skin conditions and swollen joints, believed to reduce inflammation and pain. This dual use, internal and external, demonstrates the sophisticated approach of ancient practitioners. Ashwagandha was seen as a holistic healer, nurturing the body, calming the mind, and supporting the musculoskeletal system. Whether for growth, endurance, recovery, or vitality, its role was always restorative. Its rich history of diverse applications forms the foundation for ongoing scientific research. Modern studies continue to validate the wisdom of these ancient traditions. Ashwagandha remains a cornerstone of holistic health, bridging past and present. Ashwagandha's therapeutic power comes from its complex chemistry, especially in the root. Scientists have identified over a dozen alkaloids and more than 50 withanolides, steroidal lactones responsible for its adaptogenic and anti-inflammatory effects. Withanolides, structurally similar to ginsenosides and Panax ginseng, are key markers for quality and potency. The root also contains flavonoids, potent antioxidants that protect cells from oxidative stress and support longevity. Saponins in the root may further enhance its adaptogenic and immune-modulating actions. Rather than a single compound, it's the interplay of these phytochemicals that gives ashwagandha its broad benefits. This chemical diversity is typical of traditional herbal medicines, working through multiple pathways to restore balance. Research is mapping how ashwagandha's compounds influence biological systems, from cell cultures to animal models. These studies are uncovering the connections between its chemistry and its wide-ranging effects. Science is steadily confirming what tradition has long known. Ashwagandha is a powerful, multifaceted remedy. Two withanolides, withaferin A and withanolide A, stand out for their potent anti-inflammatory and neuroprotective effects. Their concentration is used to standardize ashwagandha extracts, ensuring consistent potency. Both compounds are rapidly absorbed, allowing them to act quickly in the body. However, ashwagandha's true power lies in synergy. Its many compounds work together for greater effect. Both water and alcohol extracts show therapeutic benefits, indicating a broad spectrum of active constituents. This synergy enhances efficacy and buffers side effects, making whole plant extracts preferable to isolated compounds. Minor constituents like alkaloids, flavonoids, and saponins support and modulate the actions of the main withanolides. Some compounds improve absorption, others target complementary pathways. This intricate interplay allows ashwagandha to address complex conditions like stress and inflammation. In ashwagandha, the whole truly is greater than the sum of its parts. Research is revealing how ashwagandha calms the mind and strengthens the body. Lab studies show its compounds mimic GABA, the brain's main calming neurotransmitter, explaining its use for anxiety and insomnia. By enhancing GABA-like activity, ashwagandha reduces neuronal excitability and promotes restful sleep. Its adaptogenic effects are linked to steroidal withanolides, which help modulate the body's stress response via the HPA axis. This action builds resilience, making the body more efficient at handling stress. Withanolides also influence growth factors, antioxidant enzymes, and heat shock proteins, protecting cells during stress. These pathways bolster the body's defense mechanisms and maintain balance or homeostasis. Ashwagandha's complex chemistry allows it to act on multiple systems at once. The result, a profound tonic effect that supports both mind and body. Modern science is only beginning to unravel the full scope of its mechanisms. Ashwagandha is renowned for helping the body manage stress and anxiety. Clinical trials show it reduces perceived stress and lowers cortisol, the primary stress hormone. Its species name, somnifera, means sleep inducer, reflecting its traditional use for relaxation. Unlike sedatives, ashwagandha restores balance, normalizing sleep patterns and improving sleep quality over time. Studies confirm it helps people fall asleep faster and sleep more soundly, especially those with insomnia or anxiety. Systematic reviews show greater improvements in anxiety and stress scores compared to placebo. In trials, ashwagandha outperformed psychotherapy and placebo for reducing anxiety and boosting concentration. Participants also reported less fatigue and better overall well-being. Animal and human studies show it normalizes neurotransmitters and improves quality of life, even in challenging conditions. Ashwagandha's holistic benefits make it a powerful ally for modern stress. Ashwagandha's neuroprotective effects are well documented, with research showing promise for conditions like Parkinson's and Alzheimer's. Its withanolides combat oxidative stress and inflammation in the brain, key factors in neurodegeneration. Emerging evidence suggests benefits for psychiatric disorders, including schizophrenia with anxiety or depression. Traditionally used to sharpen memory, ashwagandha is now clinically shown to improve cognition, attention, and reaction time. Most studies report cognitive benefits with minimal side effects, making it a safe option for brain health. Standardized extracts reduce neural oxidative damage and enhance proteins vital for neuron growth and communication. This may promote neuroplasticity and the formation of new neural connections, supporting learning and memory. Ashwagandha also modulates neurotrophic factors and proteins essential for neuron survival and function. Its immune benefits include activating macrophages and enhancing the body's first line of defense. Ashwagandha stands out as a holistic tonic for mind, memory, and immunity. Ashwagandha has shown considerable promise in helping to address the cluster of conditions that occur together in what is known as metabolic syndrome. This syndrome includes risk factors like high blood sugar, elevated cholesterol, and excess body fat around the waist, all of which significantly increase the risk for serious cardiovascular disease. By helping to mitigate these factors, ashwagandha can aid with weight management, particularly in adults who are under chronic stress, as high cortisol levels are known to contribute to abdominal fat accumulation. Research has shown it possesses cardiotropic and cardioprotective properties in animal models, suggesting it has a direct beneficial effect on heart tissue and function. The herb has a long history of traditional use in the management of diabetes mellitus, and modern research is beginning to validate this application. A major 2020 systematic review and meta-analysis evaluated the efficacy, safety, and tolerability of ashwagandha specifically for managing diabetes. The analysis found that supplementation significantly helped to restore altered levels of blood glucose, HbA1c, a marker of long-term glucose control, insulin, and the lipid profile. It also improved markers of oxidative stress, with no safety concerns noted. In another study on hypercholesterolemic patients, ashwagandha was shown to significantly decrease serum total cholesterol, triglycerides, low-density lipoprotein, and very low-density lipoprotein cholesterol compared to baseline values. Traditionally celebrated for its ability to promote fertility and enhance libido, modern studies have now provided clinical evidence of ashwagandha's ability to enhance reproductive health, particularly in men. It has been shown to improve semen quality by increasing sperm count and motility, while also beneficially modulating serum hormone levels in infertile males. A 2019 randomized clinical trial investigating the effects of the herb in aging, overweight men found that intake was associated with an impressive 18% greater increase in DHEAS, a vital precursor hormone, and a 14.7% greater increase in testosterone levels compared to the placebo group over an 8-week period. A 2018 systematic review, focusing on its therapeutic effects on the reproductive system, concluded that ashwagandha improved male fertility in a myriad of ways. This included direct enhancement of semen quality and spermatogenesis, or sperm production. It also helped to improve the balance of luteinizing hormone and follicle-stimulating hormone, which in turn can lead to better folliculogenesis and increased gonadal weight. 2 other trials assessing its effect on male infertility found similarly positive results, with significant improvements in sperm quality, enhanced semen antioxidant parameters, and increased serum luteinizing hormone and testosterone after just 3 months of supplementation, alongside a significant decrease in cortisol levels. The benefits of ashwagandha are not limited to human health. This versatile herb has a history of use in traditional veterinary medicine and is gaining recognition in modern holistic animal care, including for our equine companions. Historically, the roots were used to address a variety of ailments in livestock and domestic animals, from respiratory issues like coughs to conditions such as dropsy, which is a term for fluid retention or edema. Its anti-inflammatory properties were harnessed for treating rheumatism, while its antimicrobial effects made it useful for topical applications on scabies and sores. A particularly notable traditional use was its administration to ruminants like cattle and goats to help promote and increase the flow of milk, supporting the health of both the mother and her offspring. In contemporary veterinary herbalism, the applications for ashwagandha have expanded, drawing parallels to its uses in humans. It is considered a valuable adjunct therapy for a range of chronic conditions in animals. For instance, it can be used to support animals with aspergillosis, which is a fungal infection, due to its immune-modulating effects. It is also highly regarded for its ability to mitigate the physiological impact of stress in laboratory animals, a principle that can definitely be extrapolated to performance horses or anxious pets. For older animals suffering from degenerative conditions like osteoarthritis or cognitive dysfunction, ashwagandha's anti-inflammatory and neuroprotective qualities can offer significant support, improving their comfort and quality of life in their senior years. The herb's adaptogenic qualities make it particularly useful for animals undergoing long-term medical treatments that can be taxing on the body. It may be used as an adjunct to cyclophosphamide chemotherapy or long-term prednisolone therapy, helping to buffer the body against the harsh side effects of these powerful drugs and support overall resilience. For animals suffering from anemia, convalescing from illness or surgery, or diagnosed with conditions like hypothyroid disease, ashwagandha can act as a restorative tonic. Its potential role in helping to manage hypertension is also being explored. Much like in humans, it is a primary choice for cases of emaciation and chronic diseases, especially those that have an underlying inflammatory component, helping to rebuild strength and vitality. Furthermore, there is growing interest in ashwagandha's potential preventive role in cancer for animals. While more research is needed in this specific area, its known antioxidant and immune-enhancing properties suggest it could play a supportive role in maintaining cellular health and bolstering the body's natural defenses against abnormal cell growth. For the performance horse, this herb can be a powerful ally, helping to manage the stress of training and competition, supporting muscle recovery, and promoting a calm, focused demeanor. Its ability to support the endocrine system can also be beneficial for horses with metabolic challenges, making it a truly holistic herb for supporting equine health and well-being from multiple angles. When considering the use of ashwagandha for any animal, including horses, safety must be the foremost priority. Generally, ashwagandha is considered to be relatively safe and is well tolerated by most animals when administered within the prescribed dosage range. The key to its safe use lies in correct dosing, which can vary significantly based on the animal's species, size, age, and specific health condition. It is crucial to start with a low dose and observe the animal's response carefully before gradually increasing to the recommended amount. This cautious approach helps minimize the risk of adverse reactions and ensures the herb provides benefit without causing undue stress. Despite its excellent safety profile, large doses of ashwagandha can cause adverse effects. The most commonly reported issues are gastrointestinal upset. An excessive amount can irritate the digestive tract, potentially leading to stomach pain, diarrhea, and in some cases, vomiting. These effects are typically dose-dependent and resolve once the herb is discontinued or dosage corrected. This underscores the importance of adhering to dosing guidelines provided by a qualified veterinarian or veterinary herbalist. A significant caution for breeding animals. Very large doses may possess abortifacient properties. This means at high concentrations, it could potentially induce a miscarriage. Therefore, avoid using ashwagandha in pregnant animals unless under strict veterinary guidance and supervision. This precaution ensures safety of both mother and developing offspring. Always disclose if an animal is pregnant or intended for breeding when discussing herbal options with your healthcare provider. It's essential to consider interactions with conventional medications. Ashwagandha can potentiate the effects of barbiturates and may have additive effects with sedatives or anxiolytic drugs. Extreme caution is advised if your animal is taking sedative medication. Always provide your veterinarian with a complete list of all medications, supplements, and herbs your animal is receiving. Responsible herbalism requires open communication and collaboration with your veterinary professional to ensure the safest outcome for your animal's health. In conclusion, ashwagandha stands as a profound testament to the enduring wisdom of traditional herbal medicine, seamlessly bridging the gap between its ancient roots in Ayurveda and its growing relevance in modern wellness. For over 3 millennia, this remarkable herb has been revered as a Rasayana, a powerful rejuvenative tonic capable of restoring vitality, enhancing strength, and promoting longevity. Its historical applications are vast, from supporting individuals through convalescence and weakness to calming the mind and soothing inflammation. The traditional view of ashwagandha as a holistic healer, one that nurtures both the body and the spirit, has been consistently validated by an expanding body of contemporary scientific research, affirming its place as a premier botanical remedy. The journey through the scientific landscape of ashwagandha reveals a complex and sophisticated phytochemical profile, with its rich array of withanolides, alkaloids, and flavonoids working in synergy to produce its wide-ranging therapeutic effects. Research has provided clear mechanisms for its most celebrated benefits, such as its GABA mimetic activity, which explains its calming effects on anxiety and sleep, and its ability to modulate the HPA axis, which underpins its powerful adaptogenic properties. Clinical trials have repeatedly demonstrated its efficacy in reducing stress, improving cognitive function, supporting metabolic health, and enhancing reproductive vitality, moving it from the realm of folklore to evidence-based natural medicine for people around the world. This remarkable herb's utility extends with equal promise into the realm of veterinary medicine, offering a natural and supportive option for the health of our animal companions, including our cherished horses. Its traditional veterinary uses for conditions ranging from respiratory ailments to promoting milk flow have paved the way for modern applications in managing chronic stress, osteoarthritis, cognitive decline, and offering supportive care during taxing medical treatments. For the performance horse, ashwagandha presents a valuable tool for managing the pressures of training and competition, supporting musculoskeletal health, and fostering a balanced, focused temperament, thereby enhancing both performance and overall well-being in a natural, holistic manner. Ultimately, ashwagandha's legacy is one of balance and resilience. Whether it is helping the human body adapt to the relentless stressors of contemporary life or supporting an animal through chronic illness, its core function is to restore equilibrium and build strength from within. Its excellent safety profile, when used appropriately, makes it an accessible and valuable ally for a wide range of individuals and conditions. As we continue to rediscover the profound healing potential held within the natural world, ashwagandha stands out as a shining example of an ancient herb perfectly suited for the complex health challenges of modern times, offering a gentle yet powerful path toward greater health and vitality.